why do you use the intranasal delivery method for stem cells?
Okay, this method is more targeted and it's much efficient than the systemic delivery that is used currently for delivering of stem cells to the brain. And it's non-invasive in comparison to the surgical transplantation, and it's very efficient. We can deliver up to 30% of applied cells to the brain. And it's of course very nice procedure for for patients because it's very good, well tolerated. Well, we have only preclinical trials now on intranasal delivery of stem cells, but even animals tolerate this delivery very well, so you don't need an anesthesia for this procedure. Yeah.
And I would just add to that the cells do end up in the brain, and they don't end up in your lungs and other places that if you give them systemically, they might. And of course, you don't have to do neurosurgery to implant them.
Why are the intranasal therapies of using stem cells possibly more accepted by the FDA than other protocols?
Well, the non-invasive nature, I think, is a big factor. So you can imagine that if the FDA, if you were going to propose a clinical trial, and you have one group that's going to be treated with stem cells, and another group that you have to give a placebo to. If you actually had to surgically implant those cells, you would have to surgically do surgery and do a placebo. The FDA is not going to want to approve that kind of placebo involving a surgery on someone where you're not even giving them anything. And so it's non-invasive, it's much less risky to the patient. And the targeting, which Lucina talked about before, to the brain means that you're not going to have the side effects in other organs because the cells are only really being delivered where you want them. So the FDA would like both of those things, I think.
What are the benefits of this delivery method?
Well, as we already told, that this is a very targeted delivery, and it's avoid or bypass the blood-brain barrier, so these cells are not get stuck in the lung vessels. We know for systemic administration that this is about 60 to 80% of cells are trapped in the lungs without this having a chance to be delivered to the brain. It's very important that this delivery method also allows for chronic application, which is not which is not possible with surgical transplantation. Yeah.
And you know, the main reasons that therapies for brain disorders are not approved are either that they're not very effective because the therapeutic doesn't reach the brain, or because you have adverse side effects. And this method assures that your cells do get to the brain and that you don't deliver them other places that would cause those effects. So it really is a two aspects to it that are both very important.
Please describe the future for intranasal delivery and your opinion about the timeline for availability to patients in the United States.
Well, I think the future of intranasal delivery will start with intranasal therapeutic biologics like insulin. We already are in human clinical trials. Phase 2 trials have been done already. There have been 5 phase 2 trials done in normal adults in Germany with intranasal insulin by Jan Born and others in Germany. And these have shown improved memory and no change in the blood level of insulin, which you're delivering, which is very important. In the United States, intranasal insulin has been through at least 4 phase 2 trials in Alzheimer patients and people with mild cognitive impairment. And again, you see improved memory, you see improved functioning. Again, no changes in the blood levels of the therapeutic. So I think this is where initially we will be trying to get the FDA to approve this treatment. Phase 3 trials, I believe, are scheduled to begin around the end of this year. And then I would look subsequently to see the clinical trials begin with intranasal stem cells and other kinds of therapeutic cells later.